Well, what does it mean to go all in? Well, it means actually you're not just providing health insurance anymore. You're really providing a comprehensive health package that includes wellness, giving people health risk assessments, monitoring their cholesterol, monitoring their blood pressure, ensuring they quit smoking. It's providing on-site fitness facilities or memberships in gyms to encourage workers to exercise. It's providing on-site primary care clinics that take care of workers and their families so they don't have to leave the job. It's providing on-site dental care, pharmacy that keeps the cost of drugs low, diet and nutrition counseling that encourages workers and their families to eat better. It also means adjusting the benefits, that is how much of a premium workers pay, how much is reimbursed, what their co-pays are for various services to encourage or actually require healthy living and utilization of these wellness benefits. This comprehensive healthcare package can lead to substantial cost savings as well as real devotion of workers to the company. We visited QuadGraphics, that's a printer up in Milwaukee, Wisconsin, which has instituted this all-in health coverage, and they actually save about 25% on their healthcare premium. And they have very loyal workers who really appreciate and like the healthcare benefits they get for the company. But being all in on healthcare requires substantial effort and scale. It's very hard for a smaller employer to run these kind of clinics or fitness facilities or provide dietitians with nutrition counseling unless you have kind of 800 employees concentrated at a work site. In addition, this requires a large amount of investment, human resources to manage the complex healthcare provision, as well as capital to provide the clinics, the wellness services, the dietitians. So that's going all in. It'll be attractive to some employers who really want to take full control of their workers' health coverage and provide the best quality they can. For other employers, they're going to want to go out of the market. Darden, Sears, IBM, and others have decided that providing health insurance is not their best job. And the individual market with the exchange is going to be much more attractive. There are a lot more insurance offerings. Today, most employers who give employer-sponsored coverage don't give their workers a choice. They tell them this is the one company you're getting health insurance from. So the exchange offers more choice, a wider range of options at 4 metal tiers for people to choose from, and then better prices because of the pooling effect. And I also think offering health insurance is not going to be so essential to attracting and retaining employees when they know they can actually get a good product out in the exchange. And finally, in 2018, remember the Cadillac tax kicks in. And that tax requires employers to pay an excise tax for very expensive health plans, over $27,500 in 2018 for a family of 4. And the employer will have to pay that bill. A lot of employers will decide they'd rather not face the Cadillac tax. And that means they will give their workers an option to go into the exchange. Now, who is going to go first? Well, smaller employers, 50 workers and less, they don't face a mandate and a penalty if they don't offer health insurance. For them, I think this is a relatively easy choice. The other employers who are 51 employees to 500 employees, they're subject to the mandate, but frankly, they have relatively little bargaining power with their insurer because they don't offer that many workers, and they don't have a lot of scale to provide comprehensive health coverage like QuadGraphics does to their workers. It'll cost them a lot, and they don't really have the ability to do that. I think for them, sending their workers into the exchange is going to be attractive. So, what do they face? Well, if they don't provide health insurance, they'll raise their employee wages to compensate for dropping of health benefits to make work more attractive, or they'll offer a defined contribution to the individual so they can buy insurance in the exchange. The consequence is that some employers, probably a minority of them, are going to go all in and provide total health care benefits to their workers, see real savings, and a healthier workforce. And some employers, probably more of them, are actually going to decide that they don't want to offer health insurance, that it's better for their workers to go into the exchange with a defined contribution or get the subsidies. And that's going to be the choice faced by an increasing number of employers as the decade proceeds. And I think we're going to see more employers, especially of the medium and small size, exiting the market. So we've seen 4 big megatrends. First, the rise of VIP or concierge care for patients who have chronic illness and then mental illness to prevent them from getting sick. Second, the flowering of digital medicine and the ability to monitor patients wherever they are outside of the hospital or the physician's office to improve the care that they get. The result is fewer patients in the hospital and hospitals closing. Third, we saw that the Affordable Care Act is transforming the landscape for insurers, and they are not going to be able to stand still. They're going to have to evolve or go extinct. And I think the most likely evolution is they're going to partner with a variety of health systems and get into the business of providing health care, not just providing health insurance. And today, we looked at the impact of the Affordable Care Act on employers, presenting them with a choice between providing comprehensive health benefits, wellness, fitness, dental benefits, pharmacy benefits, as well as on-site primary care, or putting their workers into the exchange with a defined contribution or subsidies and allowing them to choose what health insurance they want. Next, we're going to look at the impact of the Affordable Care Act on the healthcare training, how we prepare doctors and others for the new healthcare system. How is the Affordable Care Act going to transform the academic health centers in this country?